Have you ever gone to a doctor, done a routine scan, and walked out thinking everything was fine, only to start feeling worse weeks later, dizzy, weak, or confused? What if I told you that one of the most common medical tests for seniors, a test millions take every year, might silently be raising your risk of stroke overnight? I know it sounds unbelievable, but today we're pulling back the curtain on something most people are never warned about. And if you're over 60, this could be one of the most important videos you'll ever watch. Welcome to WellNexus Seniors, the place where we decode your health and help you live your best years with strength, clarity, and truth. I'm not here to scare you, but I am here to alert you, because today I'm going to reveal the top 5 routine tests that seem harmless, but carry hidden stroke risks you were probably never told about. And the first one? You've likely done it at least once in the past 2 years. 1. CT scan with contrast dye. The silent disruptor. Every year, millions of seniors undergo CT scans with contrast dye. It's a routine test. You walk in, lie still for a few minutes, and within hours, doctors can see detailed images of your brain, spine, or internal organs. It feels harmless, almost like taking a photograph. But few people realize what's actually happening beneath the surface. The contrast dye injected into your veins is not just a liquid, it's a powerful chemical agent, and in some cases, it can trigger a dangerous chain reaction inside the body, especially for older adults. One of the primary concerns lies in how the dye affects blood vessels in the brain. Studies show that contrast agents, particularly those used in brain and spine imaging, can temporarily alter blood flow, increase pressure inside small vessels, and disrupt the blood-brain barrier. For seniors, this is especially risky. As we age, our blood vessels become more fragile, our kidney function often declines, and our ability to regulate blood pressure becomes less efficient. Injecting contrast dye into this already vulnerable system can cause unexpected side effects, from headaches and confusion to mini-strokes that go unnoticed until it's too late. What's worse is that certain compounds like iodinated contrast agents or gadolinium-based dyes can linger in your body longer than expected. In healthy individuals, the kidneys flush them out fairly quickly. But in seniors with reduced kidney function, a condition that often goes undiagnosed, this process slows down. The dye remains, building up toxicity, possibly inflaming blood vessels and increasing oxidative stress in the brain. It's no wonder that many patients report dizziness, memory fog, or disorientation days after the scan, chalking it up to just getting older, when in fact, their brain may be signaling a warning. And then there's the silent impact on blood pressure. Some patients, especially those with hypertension or diabetes, experience a sudden spike or drop in blood pressure following the injection. This fluctuation, combined with narrowed arteries in the brain, can dramatically elevate the risk of an ischemic event, a blockage that cuts off blood flow and leads to a stroke. Now here's what's even more alarming. Many of these reactions are underreported. Why? Because they often appear delayed. You might have a CT scan today, but the symptoms show up tomorrow or even a week later, making it hard to link the two. Some seniors are even told they're just stressed or dehydrated, when the real culprit is the dye that was quietly injected into their bloodstream. The takeaway? CT scans can be life-saving when used properly, but they're not as harmless as we're led to believe, especially not for seniors. Always ask your doctor, is the contrast dye absolutely necessary? Are there alternatives like an MRI without contrast, or a regular scan that could provide similar information? If you've ever had side effects after a scan, speak up. What seems like a simple test could be a major turning point in your health story. 2. Fasting blood tests, the hidden danger of empty stomach testing. Fasting blood tests are among the most routine medical procedures in the world. Your doctor tells you to stop eating after dinner, show up early the next morning, and let the lab take a few vials of blood to check your glucose, cholesterol, or other markers. Sounds simple, right? But what if I told you that for adults over 60, this common test might be setting the stage for serious complications, including falls, blackouts, or even stroke-like symptoms? Let's break it down. As we age, our bodies handle blood sugar differently. Even a short period without food, like overnight fasting, can lead to hypoglycemia or low blood sugar, especially in seniors who are on medications for diabetes or blood pressure. Now imagine arriving at a clinic early in the morning, already hungry, with no food or water for 12 hours. Your blood sugar is low, your brain is foggy, and now a technician is about to draw blood, which can trigger a drop in blood pressure or even vasovagal syncope, a sudden fainting episode caused by stress or dehydration. This might sound rare, but it's more common than you think. Seniors are especially vulnerable to drops in blood pressure when they stand up too fast, sit for too long, or lose fluids. Now, combine all of that with fasting, anxiety about needles, and blood loss, even if minimal, and you've got a recipe for dizziness, confusion, or worse. Some seniors walk out of the lab feeling lightheaded, stumble on a step, or even fall in the parking lot. Others go home and suffer a transient ischemic attack, TIA, a mini-stroke, without realizing it. But it doesn't stop there. Fasting can also impact cardiovascular rhythm. Without adequate nutrients, your heart may begin beating irregularly or inefficiently. In certain cases, low potassium levels from extended fasting can disrupt the heart's electrical system, increasing the risk of atrial fibrillation, a condition directly linked to stroke. And yet, this isn't mentioned on the test order. There's no warning. No one says, hey, if you're over 60, you might need to prepare differently. And what about hydration? Most seniors don't realize that fasting includes water, unless explicitly told otherwise. Dehydration further thickens the blood, strains the kidneys, and increases stroke risk by elevating blood pressure and reducing oxygen flow to the brain. It's a silent danger hiding inside a simple instruction. Don't eat or drink anything after midnight. So what can you do? First, ask your doctor if fasting is really necessary for your blood work. Many modern tests, especially for lipids, can now be done without fasting thanks to updated lab technology. Second, clarify whether you can drink water beforehand, and do so generously unless medically restricted. Third, schedule your test early in the day and make sure someone is with you, especially if you've had any episodes of dizziness in the past. At WellNexus Seniors, we believe no test should come at the cost of your stability or safety. It's your body, your health, and your right to ask questions, even about the most routine tests, because sometimes it's the small details like a skipped breakfast that can have the biggest consequences. 3. Stress echocardiogram when heart monitoring goes too far. When your doctor suspects a problem with your heart, one of the most common recommendations is a stress echocardiogram. It sounds technical, but it's basically a test that measures how your heart performs under physical pressure, usually by walking on a treadmill or taking a medication that simulates exercise. It's meant to detect blockages, rhythm issues, or signs of heart disease, and for many seniors, it seems like a smart precaution. But what if that test, instead of revealing a hidden danger, actually becomes the danger itself? Here's the issue. A stress echo isn't just about walking on a treadmill. For seniors, especially those with arthritis, limited mobility, or prior cardiovascular conditions, the treadmill phase can push the body far beyond what it's ready for. And that's where the trouble begins. As your heart rate rises rapidly, your blood vessels expand, your muscles consume more oxygen, and your blood pressure may spike or crash. In younger patients, the body usually adapts, but in seniors, this sudden cardiovascular stress can trigger dangerous arrhythmias, oxygen drops, or in rare cases, even a stroke during or shortly after the test. And it gets even riskier when doctors opt to skip the treadmill and use chemical stress agents instead. These medications, often injected through an IV, force the heart to work harder, mimicking the effects of exercise. But here's what many patients aren't told. These drugs can cause severe side effects, including shortness of breath, chest pain, dizziness, and, yes, transient ischemic attacks, TIAs, also known as mini-strokes. For someone with underlying vascular disease, the forced increase in heart activity can send a blood clot racing through narrowed arteries straight to the brain. But the stress echo's danger isn't always instant. Many seniors report lingering symptoms hours or even days after the test. Fatigue, lightheadedness, irregular heartbeats, or a strange sense of disconnection. These aren't imagined. In many cases, they're the result of vascular instability, meaning the body was pushed too far and now it's struggling to recover. Unfortunately, these after effects are often dismissed as normal, when in fact they may be early warning signs of serious events to come. And there's something else few talk about: emotional stress. Walking into a sterile room, being hooked up to machines, surrounded by alarms and wires, this environment alone can raise anxiety and blood pressure, which further distorts test results and puts even more strain on the heart. For seniors who live alone or have experienced past trauma, this psychological stress can be just as damaging as the physical aspect of the test. So what should you do? First, don't be afraid to ask, is there a safer alternative? Sometimes a resting echocardiogram or a simple heart rate monitor worn at home can provide similar insights without the strain. Second, if you must take the test, request that it be done with a cardiologist present and ask what safety protocols are in place. Can the test be stopped at the first sign of discomfort? What happens if your blood pressure drops or you feel faint? At WellNexus Seniors, we're here to remind you that your age doesn't make you fragile. It makes you wise. And part of that wisdom is knowing that routine tests must be tailored to your body, not the average patient. Never let the pressure to say yes to a test outweigh your right to protect your heart, your brain, and your well-being. 4. Fluoroscopy for joint pain, a hidden radiation risk in plain sight. If you've ever had a steroid injection for knee pain, hip discomfort, or back inflammation, chances are your doctor used a technique called fluoroscopy to guide the needle. It's often described as a live X-ray, allowing the physician to see inside your body in real time. That sounds advanced, and in many ways it is. It helps ensure accuracy during procedures. But what they don't always tell you is that this seemingly harmless guidance tool exposes your body to radiation levels up to 10 times higher than a traditional X-ray. And for seniors, that exposure may come with serious long-term consequences, including vascular damage and increased stroke risk. Let's break this down. Fluoroscopy involves continuous radiation, not a single snapshot. Imagine standing under an X-ray machine for several minutes while the image stays live on a screen. Now imagine doing that multiple times per year for each joint injection or spine treatment. Over time, this adds up to a cumulative radiation load, especially dangerous for older adults whose tissues and blood vessels are already more vulnerable to inflammation and oxidative stress. And that's where the connection to stroke comes in. Radiation has been shown to weaken arterial walls, leading to micro tears, inflammation, and plaque buildup. For someone who already has high cholesterol, diabetes, or hypertension, conditions that are common in seniors, this extra vascular stress increases the chance of a clot forming or a vessel rupturing. The result? A silent setup for a future ischemic stroke or even a hemorrhagic event. But that's not all. During fluoroscopic procedures, especially those targeting the spine or neck, the radiation can directly affect areas near the carotid arteries, the main vessels carrying blood to your brain. Even a small disruption or irritation in that region can lead to reduced blood flow, clot formation, or irregular heart rhythm, which again circles back to one of the major contributors to stroke in older adults: atrial fibrillation. You may be thinking, but the doctor said it's quick and safe. And that may be true in isolated cases. The problem is when these procedures become repetitive. Some seniors receive 3 to 4 fluoroscopy-guided injections a year, especially for chronic pain. Others combine it with other scans like CTs or PETs, unknowingly accumulating a radiation burden that their body was never meant to handle. The danger here isn't just one session, it's the slow buildup that no one's tracking. So how do you protect yourself? First, ask your provider if the injection can be done with ultrasound guidance instead. Ultrasound uses sound waves, not radiation, and has become highly effective for many joint and spine procedures. It's safer, equally precise, and doesn't leave behind any residual risk. Second, keep a personal log of every imaging test or fluoroscopy session you undergo. Most clinics don't track cumulative exposure, so you need to be your own advocate. At WellNexus Seniors, our mission is to help you make informed decisions not based on fear but on facts. Your health journey should never rely on shortcuts or silent risks. Always ask, Is this the safest option for me? Because you deserve a treatment plan that heals, not one that quietly harms. 5. MRI with sedation. The risk you can't see while you sleep. Magnetic resonance imaging, or MRI, is often praised as one of the safest diagnostic tools in modern medicine. It doesn't use radiation. It produces detailed images, and it's used to detect everything from tumors to joint damage to brain changes. But for many seniors, the experience of being inside an MRI machine, confined, noisy, and enclosed, can trigger intense anxiety, claustrophobia, or even panic. That's why some doctors recommend sedation during the exam, using medications to help you stay calm or even sleep through the process. But here's what few people realize. Sedation during an MRI may carry serious neurological and cardiovascular risks, especially for older adults. Let's talk about the drugs first. The most commonly used sedatives in MRI procedures are benzodiazepines and similar central nervous system depressants. These medications slow down brain activity, relax muscles, and lower heart rate and breathing. In theory, that's exactly what you want during a stressful procedure. But in practice, especially in seniors, these effects can go too far. The brain may become under-oxygenated. Breathing can slow dangerously, and the heart rhythm may become irregular, all while the patient is unaware, lying still inside a magnetic tube, disconnected from their normal sensory cues. One of the greatest concerns with sedated MRIs is hypoxia, a state in which the brain doesn't get enough oxygen. This can happen silently, especially if the patient is sedated too deeply or has underlying respiratory or cardiac issues. Even mild hypoxia, if prolonged, has been linked to cognitive decline, memory problems, and increased stroke risk. For seniors who already struggle with circulation or oxygenation, like those with sleep apnea, COPD, or heart failure, the sedation can tip the balance in a dangerous direction. And there's another layer to the risk: aspiration. When a person is sedated, the muscles that control swallowing and airway protection relax. If stomach contents rise during the exam, or if saliva is misdirected, it can enter the lungs, leading to silent aspiration pneumonia, a condition that's incredibly dangerous in older adults and can even contribute to inflammatory strokes. You may also experience post-sedation disorientation, especially if the dose is not precisely matched to your weight, age, and medical history. It's not uncommon for seniors to feel off or cognitively foggy for several hours or even days after the scan. This isn't just a side effect, it's a sign that the brain has been pushed too far. And in rare but real cases, seniors have suffered transient ischemic attacks, TIAs, or even full strokes within 24 hours of sedated imaging, especially if they were left unsupervised afterward. So what should you do? First, ask your provider if sedation is truly necessary. In many cases, deep breathing techniques, noise-canceling headphones, or an open MRI machine can reduce anxiety without medical sedation. If medication is still needed, request the lowest effective dose and ensure cardiac and oxygen monitoring will be used throughout the scan. Also, never undergo sedation alone. Always have a family member or trusted person accompany you, monitor your recovery, and keep an eye on your mental state in the hours after. At WellNexus Seniors, we believe that every medical decision, big or small, deserves full transparency. Your peace of mind matters, but so does your safety. And while no one wants to feel trapped or anxious in a machine, the answer isn't always to shut off awareness. Sometimes staying awake is the most powerful way to protect your body and your brain from the risks you can't see while you sleep. So now you know. 5 routine medical tests, each of them common, trusted, even recommended by most doctors, can, in certain circumstances, increase the risk of a stroke, especially in adults over 60. We're not saying you should avoid these tests entirely. What we are saying is, ask questions, be informed. Don't walk blindly into procedures that could silently disrupt your health. Let's quickly revisit what we learned. The CT scan with contrast dye may affect brain blood flow and pressure, especially in seniors with fragile vessels or kidney issues. Fasting blood tests, while simple, can lead to low blood sugar, dizziness, or blood pressure crashes, putting your balance and circulation at risk. The stress echocardiogram, especially when chemically induced, can overwhelm the heart and trigger arrhythmias or even strokes in vulnerable patients. Fluoroscopy, with its high radiation levels, silently adds vascular strain over time. And finally, MRI with sedation may lower oxygen to the brain, disrupt heart rhythms, or cause post-procedure fog that isn't just fatigue, it may be a warning sign. You deserve to know this. Not to live in fear, but to live in power. To walk into your doctor's office prepared. To say, I understand what this test is. I know the risks. What are the safer options for someone my age and condition? That's not being difficult, that's being wise. Every word in this video is grounded in real data from respected medical sources like the National Institutes of Health, NIH, the American Stroke Association, peer-reviewed studies in journals such as the Lancet Neurology and JAMA, and clinical insights from real-world cardiologists, radiologists, and geriatricians. This isn't internet gossip. This is truth shared with love and urgency. Because you matter. Your brain matters. Your heart matters. And your future is still full of life and purpose. Here at WellNexus Seniors, we don't just inform, we empower. If this video opened your eyes, if it gave you questions to ask your doctor, if it helped you feel seen and respected, then do one thing right now. Click subscribe. Join a growing community of seniors who are rewriting the rules of aging with strength, wisdom, and truth. Ready to take the next step toward a healthier life? Check out the recommended products that can support your journey. Find the links in the pinned comment, and most importantly, share this video with someone you love. You never know who might be walking into a test next week, unaware of the risks. A single conversation could make all the difference. Stay strong, stay informed, stay with us. This is WellNexus Seniors, where your health journey matters every single day.